My name is Florence. I'm really thankful to my son-in-law, my daughter, who has recommended me to come to this center to do my treatment. My condition was in the month of February. I was doing much of the housework preparing for the Chinese New Year. So in the end, I think I overworked, All of a sudden, my nerves and also my bones all jammed up. I was so painful. So I went to see the doctor. So the doctor give me a steroid jab, but it doesn't help. So I have to take the painkiller, a strong painkiller every day. So after taking it, I don't see that it really helps. So I went to do the Physio. Then after that, my daughter, they all see that I need to do more than that, So my daughter and son-in-law find a place here, find this center here to ask me to come to do for the treatment. So I just came here for the first time, and then after followed by a number of times, I find that there's improvement. So I'm very, very happy. I think Kai and Dr. Nicholas did a very great job. The time I still remember when Dr. Nicholas wanted to do, the treatment, I tell Dr. Nicholas, please, the softest as you can. Even though he has done so soft, I was there screaming away because when I hear the sound, it's like as though my bone is breaking. But it really helps, I'm really thankful to Kai too that she really helps me to do all the necessary treatment by giving me, massage and then teach me how to do the exercise. And then also that they did the cupping. The cupping I think really helps, At first I was very scared when they do the cupping, but it really helps and bring great improvement to me. I really am thankful to the both of them. They have been great help. My life now after the treatment was I'm very happy. Now I'm able to walk. I'm able to do cooking for my grandchildren. I'm able to, do a little bit of my own housework in the house. I'm so thankful that it is so much different from the day when I entered this center. I'm really so thankful. Sure, of course, it has really been a great blessing to me and has really seen the great improvement that even this time nowadays, I just come once in a month, I see the improvement is there. I listen to what they say and then really obey what they say and do my part at home for what they have teach me. I'm really so thankful and really very thankful to all the doctors here. And the staff here are all very friendly. Even as you enter the premises, you can see the friendliness of the people here.
Hello everyone, good evening. It's a bit overrun for today. Sorry for the delay. Okay, first thing first, I would like to congrats to Dr. Sky. He has been awarded for the TOYP 2020 by JCI, which is the World Top 10. So a big congrats to Dr. Sky. And thank you everyone for the support and the vote for the past few weeks. It has been very grateful to everyone. Can we move on to the next slide? So for today, our topic would be approach to back pain. It will be our guest speaker for today would be Dr. Sanjeev from Beacon Hospital, and also together with Dr. Sky.
Good evening, everyone. Good evening, Dr. Sanjeev, Dr. Nick, and Grace. I'm Dr. Sky Sin. I'm the founder of SIN Osteopathic. Good evening, everyone. Some of my patients maybe need some transactions. So if anyone don't understand English, can give me some comments. I try to translate for you.
Okay. I hope everyone has taken their dinner. So now I will quickly run through the giveaway. For today, we'll be giving out 3 lucky draw, which is a free treatment from our clinic. So it will be a 3 lucky draw for today, yeah? And how do you win the lucky draw? Very easy. First thing first, share the live for today. Remember to tag 3 friends, set your profile to public, and we will announce the winner at the end of the session. So stay tuned to the end and we will announce the winner. All right, for today, I'll quickly run through each of our speaker of today. First would be Professor Dr. Sky Sin, founder and director of SIN Osteopathic. Our second speaker of today would be Dr. Sanjeev, consultant orthopedic surgeon from Beacon Hospital. And lastly would be Nicholas, chiropractor from SIN Osteopathic. So let me quickly just run through Dr. Sanjeev's background. He specialized in hip joint replacement and as well as the knee replacement. He has been invited as a speaker for World Congress, International Congress, and also he has been writing many papers both internationally and locally. And now let's move on to the next slide. Now I will have Nicholas to come up to give us the clinic introduction. I'll pass the floor to Nicholas.
Hi everyone, thanks for coming today. Wow, we have 20-some viewers, great. So let's just give a brief introduction of SIN Osteopathic and rather what do we do at SIN Osteopathic. So at SIN Osteopathic, we are the one-stop clinic for any sort of skeletal or muscular conditions. Now for our clinic, it's a little bit different, okay, because we actually have a combination therapy. So later we will also list down the different professions that we have intertwining and working together. So we're actually using modern chiropractic techniques together with traditional Chinese medicine, and of course we also have our physiotherapists. Okay, and lastly, SIN Osteopathic has been serving the community for over 50 years. Dr. Sky Sin is actually the third generation, so he has been from his grandfather, his father, and now him taking over the throne. All right. So at SIN Osteopathic, we practice combination therapy. So as you can see, these are the four big professions. We have osteopathy, chiropractic, traditional Chinese medicine, and also physiotherapy. So the great thing about this is usually when you are either practicing chiropractic or even traditional medicine, Chinese medicine, or even physiotherapy, sometimes when the patient's condition is maybe a little bit out of your scope and you would like to refer, typically you will have to refer out. But in this case, at SIN Osteopathic, we have our very in-house physicians that can actually assist in cases like this. So we don't actually have to refer out. Okay, over to you, Dr. Sanjeev.
Hi, everyone, and thank you so much for the invite, Dr. Skin and Nicholas. It was a very nice introduction and very kind introduction by you guys. So today, I'm Dr. Sanjay. I'm an orthopedic surgeon. I practice in Pekan Jaya too. So I thought we'll talk about a little bit about back pain. And so usually the common questions that they usually ask me is, Dr. Sanjeev, does back pain actually happen in the young? When we go to the gym and after that we have back pain, is it common? And is pain coming down your legs? What they call lateral kind of pain and numbness. Is that common, especially in diabetics and older patients? So these are the kind of questions that the patients usually ask me, and I think it is a very good way how to explain to everyone regarding back pain. So by far, back pain is the number one common cause of pain that patients come to see a doctor. So much so that 85% of individuals or 85% of the normal people will actually come and see a doctor actually once in their life. So that means it is relatively the most common pain that is seen all around the world, including Malaysia. So what are the most common causes? Is usually either there's four kinds of main back pain. It's usually central pain, central back pain, low back pain, or when you have pain in the mornings and once you start walking around and the pain gets less. Another one is when the patient is extending his back. They also have pain like that. And the most uncommon but important one is the pain that has associated with numbness and pain coming down the legs. So who are usually the people who get this problem? It's usually the age of 30 to 50 years, and most of the cases can be sorted out by non-surgical treatment, meaning that not all patients need surgery. So they do very well usually within 3 to 4 weeks of treatment. It usually involves a multi-team effort, including uh, uh, people like doctors like Dr. Sin and Dr. Nicholas, right? Who they involve with physical therapy, physiotherapy, and other forms of back treatment. So around 50 to 90% of them do very well without surgery. So we go to the next slide.
Okay, thank you, Dr. Sanjeev. So, Dr. Sanjeev, I think before we move on, right, I just want to ask you a quick question. Yes. So, normally when patients they come in for back pain, what is the usual cause that they tell you?
So usually they're divided into two, right? The slightly older age group and the younger age group. The younger age group is usually people at the gym. They carry weights differently. Another one is manual people who carry weights and suddenly they have a sudden pain at the back, and they cannot straighten up after carrying a load of weight. So it's proven, and also in people who work in work that they have to stretch, carry things, stretching, people who are doing drilling, mechanical work basically. And these are the patients that come and say they have severe pain and they can't straighten their leg, and the pain actually needs to be addressed. And so much so that some of them really have pain and numbness and weakness, so you really need to see them.
Thank you, Dr. Sanjeev. Thank you.
Yeah.
Okay, so I will just proceed with the slides. But Dr. Sky and Dr. Sanjeev, if you guys would like to chime in at any point in time, please feel free to do so. So I'm going to just introduce what are the mainly the causes for back pain and also for some spinal misalignments. So first of all, very obviously would be actually posture. So posture when we are either standing, sitting, or actually even sleeping. All right, so how many of you are actually sleeping on your belly? I think a lot of you, usually if you sleep like this on your belly, when you wake up, neck pain, back pain, everything will start coming already. So you guys can leave a comment if you do sleep this way. And of course, posture as well. I think a lot of there's actually a lot of sedentary lifestyle that is going on. If you can see the picture over here, typically office workers, because these are pretty much a lot of our patients. Usually they spend a lot of time, even more than 8 hours in front of the computers, or some, even enjoying themselves watching TV, but perhaps not really paying attention to how they are sitting. Yes. Um, Also, very common is actually trauma. So external force trauma could be from an accident, from a fall, from a car accident. So all these can actually cause a very misalignments and stuff can happen. In the gym as well, lately I think after MCO, a lot of patients they're actually getting more active. A lot of people started hiking. What I realized in the clinic, they started hiking, and then or started out a new exercise, and then because they haven't actually been getting so much of exercise in, so it's actually very easy to get hurt. Also, we got repetitive motions. All right, this one here pretty much is if you are a office desk worker or if you are a housewife, right? You always do actions that are very repetitive. Yeah, you will tend to also get misalignments as well. And lastly, we have a genetic deformity. So this is actually scoliosis. This is a very, very obvious misalignment here.
Yeah, Nicholas, I'm going to come in. There's other risk factors that usually associated with back pain is usually smokers, and also patients who do, as what Nicholas said, repetitive work, but repetitive work carrying things. So even if you carry something for 5 kilos and you carry it like 20 times a day, you are bound to have you're bound to have some form of injury of the back if you do not practice good posturing and carrying methods bearing weight. So usually it is the number one cause of paid leave, and also the number one cause of people taking medical leave, right? And also obesity, being overweight, sedentary, not moving around, and then you're expected to do this task. And this, as what Nicholas said, after the COVID, we see our patients being more active and going outdoors and starting to do activities, and they don't do it gradually. They just go on and start doing. They're thinking they're Lee Chong Wei, or they think they're the next Cristiano Ronaldo, and they come with back pain. So I have actually experienced that myself. I've seen many patients of mine who started going to the gym right after, and all of that, and having lots of problems with that. Yeah. So obesity, smoking, carrying heavy, more than 5 kilos can cause a lot of problems if you do not know how to carry it properly. Yeah. All right. Next.
Yeah, agree with Dr. Sanjay. So for youngest, normally they are more active to sport, gym and carry weights. There will be more chances to suffer in injuries to the lower back is very common. So how many of them skip the warm-up sections before they start their workout? So I have some patients who wanted to have a very nice body shapes, which they go to gyms like crazy just to gain some muscles, but they don't know the knowledge, right or wrong, and then they rush to it. They feel like they will gain the muscles in maybe 1 or 2 days like that. So it's very wrong. Their mindset is like, if I carry as heavier as possible, that's the way that I feel that I gain the muscle faster. This is a very wrong concept. So everybody likes to work out, but it should be done in proper guidance, especially from a physiotherapy or physical trainers. Work out in the gym, everybody wants to lift weight, but certain right and wrong lifting weights is the concerns part. So your back should be very firm and stiff when you start to lifting weight. You should not bend down directly to pick up any heavy things from the floor. You should bend your knee and hip that correct way to carry weights. Then how to pick up the weights from the floor is a knowledge as well.
Thank you, Dr. Sky and Dr. Sanjeev. Very great input. Okay, so we'll move on to the next slide. All right, here you go, Dr. Sanjeev.
So the common questions are usually, I think we went through this before, but basically my patients like to ask, like, what can I do because I'm unable to walk, do work after falling down at the gym. So you actually have to, if you can't walk, I think it's something you need to see a doctor for. And then, Dr. Sanjay, what do I do if I have back pain after lifting a heavy box? It's not going away. I'm taking treatment, and I took some paracetamol and some icing, and it doesn't work. So it's time to, these are the kind of common questions that you get. Yeah. All right. Next. So as just now we said, the common risk factors, actually, there's no actually direct cause. If you do this, you will get back pain, or you will get a prolapse disc or slip disc. So these are common risk factors. So if our public is involved with this, I think you should really be careful when doing all of these risk factors. So lifting of weights more than 12 kilos is proven to increase your chances of getting slip disc. Also, vibrations and activity. If your actual work, it involves carrying heavy weights, you are actually very high risk. Exposure to vibration at your workplace, right? People who have accidents or falls, this is also another cause of it. Contact sports, you'll be amazed by the amount of falls and injuries, especially in rugby, in soccer, in Dr. Sky's clinic. A lot of patients with martial arts, mixed martial arts, they come with a lot of injuries, and we have to be safe. Yeah. And whatever the job, stretching, pulling, repetitive work, flexion and extension of the spine, this is a common risk factors, including smoking and overweight. Yeah, Nicholas.
Okay, thank you. Okay, so we're going to talk a little bit about symptoms of back pain. All right, so usually the symptoms can be categorized into two categories. All right, we have the localized back pain, or some might be familiar with the radiating kind. All right. Usually, when there's radiation, typically there should be some sort of nerve impingement that is going on already. So, how do we categorize? We actually have pain can be described in many ways. So there is dull pain, achy pain, sore, the 熏痛 we usually call it. All right. You have the burning pain, stinging pain, and usually when there's symptoms of sciatica, so radiating, usually it's accompanied with either numbness or tingling. So normally what happens is the pain will actually start from the lower back. It travels down to the buttocks, the thighs, and then the calves. So some even as bad as going to the foot, the toes. Here are actually two very good examples. Usually, very commonly, people will actually injure at either the L4-5 or the L5S1 levels. So you actually hear a lot of these terms being thrown around. It's actually very important because depending on where the nerve impingement is, typically the symptoms will also be different according to the condition. So as you can see in the L4-5 impingement, typically it's radiating from the buttocks and all the way down to the lateral thigh, but it doesn't go down the foot. If it's the L5S1, typically same from the buttocks to the thighs and then to the calf as well. For the numbness, it does play a part. For L4-5 is the big toe and usually the second and third. For L5S1 is the little pinky, right? So yes, even other symptoms will actually include things like actually you feel worse after prolonged sitting or even prolonged standing, and for some is even after sitting for long, right? When they want to get up, when they want to change position, to actually feel it's pain or it's very difficult. Hey, doctors, do you guys have anything to add?
Yes, anyone translate that? I think that'd be a good.
Translate. Okay.
Or Nicholas do it, I guess.
Doctor's Mandarin is
So
number one.
OK, so for 这个他们讲是，如果你 lower back pain，很多情形是你做的时候，通常会压迫到第4节、第5节你的腰椎或者 L5S1， so 它每一节它延伸出来的问题都不一样的，你痛的地方可能都不一样，延伸到大腿跟小腿的部分。So L4、L5 的地方呢，通常会在我们脚趾的大拇指、第2指、第3指那里。如果你压迫到 L5S1 的地方呢，通常都会在我们的尾指方面会比较明显的有麻木的感觉啊，或者刺痛或者 burning sensations 的感觉也是有。That. So as I realized, the most common reason for prolonged sitting, especially at the workstations, 8 hours at stress without a break, that is definitely cause the back pain. Second, if you physically out of shape, especially if your core muscle and abdominal muscles and your lower back muscles, they are not strong. If you're not adopt proper posture, you should always sit erect with your neck and the head centrals without slouching. If you do not follow this right posture and work for long hours, then you definitely will having a lower back pain in one day.
So guys, basically the symptoms of back pain, this as what Dr. Nicholas and Dr. SIN said, that this is a common. It usually comes with actually central back pain going from your back, lower back, down to your legs and toes. You have slightly older age group patients. They come with pain usually when you're getting up in the morning, and it gets better later on in the day, right? And then also most of the patients come with this severe back pain, right? They can't do anything, and a small portion of them have chronic back pain. That means patients who have pain for more than 3 months. So these are the kinds of pains that usually comes to, and if you have laticity kind of pain, electric coming down both your hips going downwards, if you have numbness or you have difficulty or weakness, I think it's very late, and you need to probably see a doctor for that. Yeah. All right. So I think we can go to the next slide.
Thank you.
So this is just a nice slide just to show you that pain is quite difficult to deal with. It starts with from the edge of the skin. It goes to the nerves, and then it goes up to the main spinal cord, or where your nerves, or where you can feel, and it goes up to your mind. So we usually deal with the pain in different levels. So the treatments that we usually do, me and Prof. Sin, we combine together all these ways and methods to try to reduce pain at all levels. But the initial one, the best way is to prevent all of this. Yeah. Okay, next one. The next slide. So what happens is when you have pain, or you have you have low back pain, the pain causes it to have less blood supply, and this causes the accumulation of acid, and this causes you not to move more, and this becomes a problem. It becomes a pain cycle where you have pain, you're not moving, and you have spasmodic pain, right? So this is a common occurrence especially in low back pain. So this, we need to break the chain, and these are the methods we are going to show you how we usually do it, and what works and what doesn't. Okay, next.
Thank you. Okay, so this is what we normally treat at SIN Osteopathic. Of course, there are actually ranges of condition, but since today we're talking about back pain, right? So typically anything that covers musculoskeletal pain or injuries, we actually do see them, typically joint pains or even dysfunction. So if you can see in the middle picture, right, let's say if there's a misalignment that's happening, an imbalance in the vertebrae or even in the SI joints, normally you can see that the nerves that are traveling down, sometimes because of misalignments, they can actually be impinged. So this is considered a joint pain or even joint dysfunction. So of course we do take note on neck pain, back pain, all right, and of course muscles as well. So normally if there are muscle aches, muscle stiffness, yeah, we do cover that. Okay, so move on to the next one. So how do we normally treat? Of course, depending on the condition, but this is just a plain overall. So normally after consultation, we will typically start with the soft tissue release first before we actually do any sort of manipulation. We'll always start with soft tissue therapy. All right, we're going to release the myofascial tissues. So after that, we'll move on to the adjustment. And then if there are any appropriate exercises to be prescribed, that will be done as well, so that maybe the patient can perform at home, so that, to maintain their alignment. And then also, if required, to stabilize either the joints, or we even have traditional herb wraps to help reduce the inflammation. So it's either using the kinesio tape or we bandage it up. And lastly is if the condition, if even from the consultation straight away, if it's a very severe case, typically it's the one that we will refer out to Dr. Sanjeev. So if you guys don't mind, actually, because exercise is actually a very important part of the overall treatment as well, I would actually like to bring up our physiotherapist just to explain a little bit on the benefits of physiotherapy. So I'm just gonna bring up Catherine here.
Yeah. So if I could come in, Nicholas. Yeah.
Sure, Dr.
Hi, Catherine.
Sanjeev. Yes.
Welcome to the talk. So how we deal with with back pain is actually multimodal. That means we have different specialists working on the same patient. So we have an osteopath like Dr. Sin, and we have Nicholas, who's a chiropractor and a physiotherapist, and then we have Catherine, who's a physiotherapist. So it's usually combined with a surgeon who sees the patient, right? We see the patient and we actually treat every patient differently. So it's a combination of specialties, not just one treatment for everything. So it depends on which kind of pain you have, whether it's acute, or it is just suddenly appeared, or it's been there for 6 months or 3 months. We will treat it differently. Mainly, we will start with a physical examination by a doctor, right? And after that, we need to see whether it comes to the 10 or 20% of them only need to be seen or need to be treated surgically, so that 80% will do very well usually. 70 to 80% of them will do well without surgery. So what is the treatments we usually give? It will, after seeing the doctor, we usually will start the patient on physical therapy, chiropractic manipulation, medicines. We'll start them on medicines. We'll start them on physiotherapy. We'll ask them for acupuncture is another good option. As what Nicholas said, tension release, massages, and chiropractic manipulations, spine manipulations are also proven to do very well. Things like Tai Chi, yoga also helps. And especially now, Catherine will probably come and tell you about the different exercises that can actually be done and that greatly helps with back pain. Yeah? Okay, go ahead, Catherine.
Okay, so I'm Catherine. I'm the physiotherapist in SIN Osteopathic. So I would like to talk a bit about benefits of physiotherapy. So usually physiotherapy will be divided into short-term goals and long-term goals. So in short-term goals, we will first target to reduce and eliminate pain first. So as Dr. Sanjeev has shared just now, because pain causes reduction in the mobility, so we need to reduce pain and inflammation first through manual therapy or any electrical modalities. After that, when pain reduces, then we will improve the joint mobility as well as the flexibility. So once the joint mobility is improved through joint or stretching, then we will target on the muscle strength. So we will strengthen the weak muscle group to improve the patient's balance and coordination. This will help to prevent any recurrence of the injuries and any falls in the future. So in the long-term goals, our main goal for the long term will improve the quality of life and bring patients back to activities of
All right. Thank you, Catherine. Thank you. Okay, so we shall be moving on. All right. So some referral conditions. Okay, so what kind of conditions typically are seen by, let's say, an osteopath or like chiropractor, and what are some conditions that are required to be referred out to an orthopedic? So these are some of the conditions. Of course, for an orthopedic side, let's say like fracture, things like fracture and infection, tumor, all right, or cancer, caudal equina syndrome, or even progressive neurological deficit. So these are conditions that typically would be referred out to an orthopedic like Dr. Sanjeev.
So guys, usually referrals to orthopedics, it's usually when the patients do not do well after treatment by a doctor. So doctor sees the patient, gives treatment for 2 to 4 weeks, right? As long as it doesn't come very severe or weakness or having difficulty in passing urine or something like that, that's emergency. But these are actually quite rare to have such a bad slip disc. Usually 70 to 80% of them will do better after treatment, and the treatment usually it involves physiotherapy, medications, physiotherapy, some medical leave, being active, and going for physio and chiropractor and all of the rest of the interventions. So when would you need to see a doctor? Any doctor will be when you take medicines, like if you have back pain. I usually tell my patients, if you have back pain and you think it's just a small slight pain, I suggest you go get some paracetamol, get some sprays, some creams from the pharmacy, try and rest, do some ice packing and a warm pack, and see whether it gets better. If it doesn't get better, if it's associated with pain that is prolonged, and then I think you need to go see a doctor like Dr. SIN, and we'll see how we can help you deal with the pain. But again, 70 to 80% of them do very well, and very few of them need surgery. Yeah. Okay, next.
All right. Thank you.
So I think we just went through this. So basically, as long as you have pain that more than a few days and is not getting well with your medications that you're taking, severe pain that affecting your posture and your work, you're having numbness, I think it's time for you to see a doctor. Yeah. All right. Next. So there's two kinds of when you want to see a doctor. So if you've had a fall, accident, obviously, and you can't move your legs or anything like that, then you need to see a doctor immediately to the emergency department. Another one is the majority of the patients, close to 80 to 90% of them, are actually the patients who have mild pain, some form of numbness, and they should. I usually tell them to go to do the treatment, take the medicines, and if it's not working out, then come and see a doctor. Something like Dr. SIN. Yeah. All right. Next.
Okay, so we're gonna introduce a little bit about spinal manipulation. So before that, let's just watch a quick video. Yes. Okay, so that is a very brief introduction to spinal manipulation. So I'm going to be explaining a little bit more. Hold on, yes. Okay, so before we enter into this part, just a little bit of introduction on spinal manipulation. It is a short and quick force to the spine or to the subluxed vertebrae. Okay, so the subluxed vertebrae is typically examined first. Okay, we're going to find out whether or not there is an abnormal movement pattern to it. So if that tends to happen, typically it will fail to function properly. So what spinal manipulation does is we of course want to promote and increase the range of motion. All right, range of motion being like your head looking, rotating laterally, flexing and also extension. So these are what spinal manipulation can actually help promote in range of motion. We want to reduce the nerve irritability and also increase function. So main goal once more is to restore the proper joint alignment and just to allow the body to heal naturally. Now, one thing is that when it comes to manipulation, like just now, we actually heard a little bit of what we actually call joint cavitation. So the pops and cracks that typically patients would like to hear. But yes, so that is called joint cavitation. And what that is, it's a release of oxygen, nitrogen, and carbon dioxide. So that actually releases the joint pressure. So on to adjustments. Is it safe? There are actually many studies that have been conducted. So out of 26 clinical trials, the effectiveness of uh, different treatments for chronic low back pain. Now, in terms of spinal manipulation, it is actually considered effective and on par compared to exercise, pain relief medications. It reduces low back pain, right? Back pain in general, and also improves function. So it works hand in hand, I would say. It works hand in hand. And also, there's another study that actually takes into account of 250 articles. So here's the thing about treatment, right? Most of the time, in any form of treatment, there's bound to be risk. That's for sure. So in terms of adjustments, sometimes there may be mild effects. So mild effects are to be expected, maybe sometimes such as tenderness, soreness, or stiffness. But these are just temporary and will go away in a day or two. So in the study, it says that in terms of serious adverse events, only 1 of every 2 million spinal manipulations. So 1 out of 2 million spinal manipulations and of 13 per 10,000 patients. Okay. Doctors, you guys have anything to add?
According to the normal the guidelines, they actually say that with better understanding of spine, and as we go along, we want to find out what works and what doesn't. And there's evidence to show that spinal manipulation actually has some evidence, along with acupuncture, along with physiotherapy methods. They have evidence, and it is evidence based. Yeah, and I would suggest that. Yeah, next. So what do you advise to do when having sudden pain? So if you have sudden pain, I would suggest to stop that exertion. So sometimes you'll be bending forward, carrying things, whatever it is, stop it. Try to take some over-the-counter medications like paracetamol or some painkiller that you can find, right? If the pain relief, you can use also creams, plaster, the spray, the patches, whatever works. We are good for it, and try to get some rest, and but maintain active, maintain active. And if it's severe, I think you should take leave. It's better to take leave and rest rather than making it worse, and that you will need more you need more intervention, right? So if it doesn't, then you have to go and see a doctor. Yeah, next. So what kind of medications is usually prescribed? So usually it's a form of, as I told you this now, it's a team effort. So medications is one of the key methods, and we do not use steroids. So we have moved away from steroids for many years now. So we use more safer drugs that is safer on the stomach, safer on the heart also, right? So they are called non-opioids, right? So they're usually NSAIDs or non-steroidal anti-inflammatories, also plus with the muscle relaxant, also with paracetamol. So combination with this, with physiotherapy, with massages, and also with spinal manipulation, acupuncture, all of this works, and it helps. If it is solved that way, then it's very good. But if it's not, then you have to come and see us. Yeah. All right. Next. So actually, there is a lot of evidence stating that the stretching, muscle strengthening, posture, physical therapy, like what Prof talks about and preaches about, I think it has evidence. There is evidence of weight control. Proper physio, acupuncture also works, and also learning about ergometrics. That means how you are doing your work, the posture you at work, whether you're looking up, looking down, you are actually sitting, as what Prof said, sit down properly with your chest straight up and your spine back, right? Lumbar brace actually doesn't have that much of evidence. It's actually they say you can use it in acute, but there's no evidence to it. Yeah, and yeah. All right, next one. SIN, what do you think? How would you go about advising your patients?
For the lumbar support, you means? Actually, for acute back pain, actually for the severe time, they're having the informations, they cannot move a lot that time. I try to get them to put it on because just like someone to hold your back, doing so
Yeah,
easy to sprint again. That's
no,
all. But
yeah.
I won't suggest them to wear for long time one, only that
What
period.
what about the role of physio and the role of posture, and how do you get them to actually move again? Because when they have this pain, they kind of back pain, can't move, and then they get into the rut of that circle of pain. So how do you get them to actually go along with medicine? Yes, but what else? There's ice packing, and warm pack also helps. Yes, what else?
Yes, for the very severe time, we always suggest the ice pad lah. So we will get the inflammations to come down first and try to decompress, and then maybe the medications would help. So when the inflammations come down, the nerve compressions will be lesser. Then the mobility we can slowly to start on.
Okay. Yeah. All right. Next, Nicholas, shall we move?
Okay, so we're going to talk a little bit more towards the spine. So later we'll move on into slip disc, where Dr. Sanjeev can also explain a little bit more. So for your spine, typically 5 main components. You have the actual spine, all right, the vertebrae, the one in white, and then you have your spinal disc, all right. This is also considered as the soft tissues. You have your nerves. Your spinal cord is here. Spinal nerves are here, the one in yellow. and you have your muscles, which are right here, attaching to the vertebra. Okay, so mainly these are the 5 things that we need to know about. So in terms of joint subluxation, I'll just get this explained. So it's actually either one or more vertebrae that are actually out of the alignment. So as you can see, right, in a normal vertebrae like this, compared to a sublux one. So if it's out of place or misaligned, sometimes what it can do is it can place pressure onto the spinal nerves. So that is where patients will tend to sometimes feel uncomfortable or this sore or pain at the back. What this can lead to over time is actually this degeneration and also arthritis. So wear and tear, spondylosis, all these are where Mm, actually,
So basically, we all look at the diagram on the left and the diagram on the right. So a left is a normal diagram of a bone. In between the bone, there's liquid. It's like I always tell my patients, like a gasket in between 2 engine points. So now this liquid is softer in the middle and a little rougher on the outer side. So it's called nucleus pulposus and annular fibrosis. So basically, what happens is as you age, the small tears on the outer part of the water. So what happens is whenever you carry the heavy instrument or whatever the pressure is that causes it, now that liquid goes behind, punctures out and starts touching the nerve, the yellow color structure over there, and that nerve will be compressed. It's like they are compressing something. So it's either they come totally straight out in a lot of liquid, and that causes the weakness and paralysis, or they come slowly and they kind of like they just like squeeze or compress the nerve. That's where you have the pain, the numbness, the tingling sensation, and all of that. But it all starts with a tear of the liquid part and it comes out. Yeah. All right, next.
okay, thank you. All right, so for joint subluxation as well, typically we can actually link it to different organs of the body as well. So you have the cervical nerve, the thoracic, and the lumbar. So these are actually nerves that also supplies the organs in our body. So we have the parasympathetic and also the sympathetic nerves. So sometimes what can happen is if patients have like bloating or these can actually be traced back to the spine. Okay.
Yeah. So I think we talked about this just now. So we'll just move on. So this is actually the liquid that comes out, and I was telling you about. So if you look at the image on the right hand side, right, that's the right hand side, the upper diagram. That is actually the liquid water, and behind the yellow structure is your spinal cord. So now this is a normal one above, and now below the lower one on the right hand side, that's when the liquid, the inner liquid, the gel comes out and it touches the nerve, and that is the one that causes the pain. So it depends on how much of nerve comes out and how narrow it is and how much of the nerve gets stimulated. So as what Prof was saying, it causes inflammation. So it affects the nerve 2 ways. One is by physically, and another one is the chemicals it comes out with. So Prof is more inclined to, I mean, he has more knowledge and experience with the inflammation part. So but what he said about the inflammation is true. So we can treat it by either removing the part or reducing the inflammation. Yeah.
Okay.
Okay, next. So I think my patients usually they come in this kind of they have back pain after carrying or doing activities, and the pain is usually centrally, or they come down their legs, and then they have difficulty. Some of the patients notice that they cannot feel when they pass motion or something. They cannot feel the skin around there, or it gets numb. So this is a sign that you need to see a doctor for. Yeah. All right, next. But most of the patients come with low back pain. Yeah.
So actually, if you're having the symptoms like you cannot feel, the numbness is very severe, you should go and do an MRI already. Sure need to pass to you.
Yeah. So you probably will benefit from seeing a doctor first, And then from seeing a doctor, they'll differentiate whether you need to start doing an X-ray and also later on an MRI. An X-ray will help you to differentiate whether you have a fractured bone, because in the elderly, especially above the age of 70 or 50 and above, especially for females, when they have a sudden pain over the back, not everything is slip disc. So sometimes it can be osteoporosis. And especially in patients who are taking steroid or taking inhaler for long term, they come with back pain. You need to rule out osteoporosis, which is a very common thing, especially in Malaysian society. More than 70% of certain races in Malaysia have osteoporosis. So it's very common, and we need to be aware about that. Yeah. Okay. So Nicholas, I think we are discussing some common cases. Is it? You wanted to share?
Yeah, so we're going to look at a video of an example of an acute back pain. Yes.
So actually from these videos, right, when I do the adjustment that time, not every angle is the same. So the angle, the force, I need to find the exactly which bone's having problem. So the adjustment will be different. Everyone will be different.
Yeah, actually, Dr. Sin is actually right. So no two adjustments are actually the same. They may look the same from the side, but they may not be. So we have
So,
actually one.
Prof, the patients usually ask, "Is it safe?" And I usually tell them, if you go to a certified practitioner, is usually very safe. So, is it safe? And I mean, how safe is it?
So actually, we need to know the age of the patients. As you said, you're having an osteoporosis. Do we still do the adjustment? We will say no for that, because your age already until certain age already, you need to be very careful, lah. So the youngest I do is 1 years old baby, and the oldest I do is 98 years old patients.
Wow,
So
nice.
you need to be very, very gentle. Actually, in our shop, we got a lot of device. Maybe you are not, we are not only having one way to do adjustment.
Yep.
Maybe normal people you can do 3 times, but for her, maybe you do 10 times in a different way. Be soft and
That
gentle.
that's
Yeah,
when the
this
experience
is
comes.
also based on experience, and how I teach my team how to diagnose the patient is very important. Compare maybe others, maybe they, if you do know the knowledge, do know the structure, will be some danger on it.
Yeah, I it is guys. I think there's like some questions from the patients. I think it'd be a nice one to go through them. Yeah. So there's a question from Sean K, and he said, "I've seen that Chinese medicine was included as one of a combination therapy during introduction. Mind elaborating how Chinese medicines integrated and complement well together with other treatment methods?" So yeah, I think that's a nice question. I'll let that to Prof to answer.
Okay, so for my generations, actually, I am the TCM based lah. So actually, I find out that only one method cannot solve every problems. So I'm very open-minded, and then now the technology is getting like every day is different, and we can have a lot of evidence. So like X-ray, MRI, these kind of things actually help us a lot. And then I noticed that some of the patients might do surgery. I will willing to pass out. I will not like others will keep until you cannot walk or nerve damage. This will cause patients more problem. So I think now the technology and then like professions, physiotherapists like chiro, this kind we combine together because all of them maybe uh, bone structure problem. We can use this method to do adjustment. But for the muscles wise, maybe the physiotherapy will do the best because your muscle is weak. How you do the adjustment also no use when you need to engage back the core muscles and support your movements. So I combine everything together. Lah.
Yep. So for Sean, in summary, there is evidence, and especially acupuncture. So I looked it up, and I looked up the evidence, and actually it's now standard to offer this kind of treatments, and they have evidence, and they have evidence for spinal manipulation also, physio, massage, and yoga and tai chi all helps, yeah, with physical treatment. So the next question was, there's a patient asked, what do you suggest patient to do when they have pain? So Prof, what do you suggest?
What do you suggest patients do when they pain? So we having a diagnosis lah. How pain is the West score? Maybe 10 out of 5. Then it's bearable. Then we will do the treatments lah. But the pain is like just now doctor said that is uncontrollable. Like you pass motions you also cannot control the kind that then I will refer out lah.
Yeah, so it's also known, like whatever that you're doing that causes the pain, try to avoid that. Try to do some stretching. Try to get see how it does to relieve your pain. And if it's not, then I think it's time to see a doctor.
Actually, for the first time treatments, we wouldn't do a lot of force on the patients. Mostly we do the eyes, we do the patches like Dr. Sajis mentions to reduce the inflammations. That's the first thing we do. Lor.
Yeah. There's another question, Prof. Maureen Lam, and he said, if diagnosed with mild scoliosis, what needs to be done?
Actually, mild scoliosis is not more than 40 degrees. Actually, we're having a very good testimonial. Maybe, Nicholas, you can share about the X-ray for the scoliosis patients.
Yeah, sure. I'll just jump to it. Yes, it's actually over.
Normally, the scoliosis got a lot of problem. Maybe it's the genetic, maybe it's the muscle imbalance we cause the scoliosis. This is some cases that we do. Actually, we having a very good evidence that before the treatment is 38 degrees. Normally, when the scoliosis patient need to do surgery is maybe the curve is above 40 degrees or the structure already compressed the organs. Then we feel very painful, cannot release the pain, cannot breathe. Maybe we'll suggest out. So if the scoliosis after we having a scoliometer, we can check how bad is it. So this all is the evidence that the mild scoliosis will improve. So like 15 degrees can go to 6 degrees, 29 to 23. So it cannot be perfect, but can be better or not getting worse. That's the way we do. Doctor, do you do any surgery for like this kind of scoliosis patients?
So I just wanted to add on to Prof. What you were saying. In scoliosis, actually, is quite common. I mean, it's not common; it's rare in the public, but there are a lot of patients who have mild scoliosis. Not all scoliosis you need to do something surgically. So usually, as what Prof was saying, if it's very severe and it's disturbing your breathing, then we will need to do something about it. But usually, most of them do very well with balancing, posturing, and all of that. So usually, scoliosis is not associated with back pain. especially in the young. Usually they don't have pain. It's just that it's a structural problem. And usually I don't have that much of experience dealing with them because they don't come with pain, right? They only come with severe scoliosis. So yeah, so I'm with that. Yeah. So Nicholas, you want to go on to the next one? Maybe the video.
Sure.
Yeah.
Okay, we actually have one more here.
Nicholas, I think
Hi.
you pass through others' videos or slide better.
Okay, sure. All right, let's
Maybe
let's
you
go to
can.
the yeah, no problem. Okay, so we just want to explain a little bit on, okay, aside from just spinal manipulation, what other treatments are there, right? So we have a couple of machines that we should share a little bit on how it actually facilitates and also helps uh, with spinal manipulation. So first we have the Leander flexion distraction. This is actually the very first in Malaysia, a fully automatic table. First in Malaysia in synostopathik. So this is a very great machine. What it does is it is a safe, gentle, and also a non-surgical option. What it does is it actually increases the motion. So when the table flexes up and down, it decreases pressure and it takes pressure off the nerves and also the disc. It creates a negative pressure by pulling, maybe a mild disc bulge actually back into place. Also, with the flow and the motion, it allows nutrients to be re-entered into the spinal disc, keeping it fully articulated. So this is one of it, and the next one, which is also seen in many hospitals, that is the lumbar traction. Lumbar traction similarly also works to take pressure off pinched nerves. So it stretches between the vertebrae, as you can see, decreases low back pain and also increases mobility. This one typically, let's say patients that they have any kind of this degeneration are typically more towards aging, right? So when the disc is actually decreased, so traction is actually a very great option in terms of widening up that foramina so that the spinal nerves or spinal cord can be free. So it uses exerts a centripetal force to draw the this protrusion. Okay, so these are the two machines that are also available at Synosteopathic.
So, Prof, we got last question here. We're probably going to end it soon because it's over 1 hour already. So, the last question is, Doctor, is competitive swimming related to back pain? Which is a good question. So these are examples of pain that is caused by the spine over extending. So it's either you have pain when you stoop in front or you push behind. So this is an example of extension or putting too much, stretching your back too much. So it's not is not related so much to swimming. But if you're having pain while you are doing the activity, I suggest you stop doing that activity or lower down your activity exposure and see how it goes. And if it does get better, I suggest you either change the activity but usually swimming is encouraged, and usually it's a very safe and a good method in dealing with pain. Yeah. So we got last question here, Prof. It's all coming in now. The questions. I'm having back pain for bad posture. May I know how many chiropractic sessions do I need for adjustment? So this one, I give it to both of you guys. Yeah.
Nicholas?
Okay, so of course, have to go through consultation and also a physical exam just to understand your condition better. So it really depends on the severity of it. So how it goes about is typically, maybe if some severe patients, perhaps it can actually go to 2 or even 3 times a week. So we really have to see what kind of condition it is first, having the condition controlled. After that, only going for perhaps twice a week or even once a week. And then when things are going well, perhaps even once a month, just for maintenance. What do you think, Dr. Sin?
It depends on individuals. The quickest I can do maybe 1 to 3 times. I can settle the problem. It depends how severe is it. But
Okay, I think
maintenance definitely you need.
so. We wanted you guys to like share your experience with the pain, and so we can actually, we have the experts here to maybe help you and maybe share our knowledge. Yeah, but we had a lot of questions. I think that was a great session. So shall we end it, Prof? Would you like to end the session with a last take home message, maybe?
Don't sit too much. Try to flex your back every, like, maybe if you can, 25 minutes, 30 minutes. Try to get up, walk around, drink some water, then come back and work again. And then just now the question is very interesting, that for the swimming competitions, if you train a lot, actually will cause your muscle spasm. So swimming is good. Actually, I always encourage my patients go for swimming, especially got the back pain problem, because you can do the motions, the flexions, then the oxygen can pump in, reduce the inflammation. That is good. But too much also can be a problem, just like Dr. Sajis mentioned just now.
Yeah. So I would say to everyone, I think back pain is the number one cause of pain that patients come and see me as an orthopedic surgeon. Yeah. So it's common. Most of them don't need surgery. Do not worry. And usually our treatments are multimodal and multidisciplinary. We work as a team. That means it's an orthopedic surgeon, a physician, physiotherapist, chiropractor, patient osteopathic, and then you have also roles of other forms. So it combine. When you do have pain, try to solve or stop whatever the activity you're doing. And if it's persistent, then I think you have to see a doctor for it. Yeah. Okay. All right.
Okay,
I like
thank you,
to.
Dr. Sajis, for this talk. And then I think we will end for the lucky draw sections.
Okay, I will leave. Thank you so much for hosting me, and you have great audience. And I wish to come back and we'll share some more then. Yep. Thank you so
Sure,
much.
sure.
Right.
Thank
Thank
you.
you,
Thank
Dr.
you.
Sanjeev.
Thank you,
Thank
Doctor.
you.
Good night.
All right. Thank you so much, Dr. Sanjeev. Thank you so much, Professor Dr. Skysin, and also to you, Nicholas. Thank you for tonight's sharing. Now we will proceed with our final session, which is the lucky draw. We have quite numbers of names today who joined in for the lucky draw. Let me quickly just share it out. So we will be giving out 3 lucky draws for today. 3 people for 3 winners. Okay, let me know if you guys can see my screen.
Can.
Okay, so we will go with the first spin. So the first spin treatment will be done by our physiotherapist. So let's see who will be the first winner, who will be treated by our physiotherapist. Right, first winner of the night. Congratulations to Sean. Sean, may I know, are you in the live right now? Please leave a comment in the chat box.
Congratulations, Sean.
Congratulations, Sean.
So this is what sections, huh?
This is will be handled by our physiotherapy. So it will be handled by Catherine, either Catherine or
So Sean, if you're having a muscle imbalance for lower back pain, maybe our physiotherapists would happy to help you to help you to train back your muscles become stable, especially like core muscles, the growth muscles, and others.
Okay, let's move on. For the second spin, treatment will be done by our chiropractor, Nicholas. So let's go. Congratulations to our second winner, Luis Liu. Luis, may I know if you're in the live right now? You can put in a hi in the comment box below, in the chat box. So for Luis, you will be consulted and treated by our chiropractor, Nicholas.
Thank you. We'll be seeing you soon, Louis.
Yeah, we'll be seeing you soon in the clinic. Is Luis in the comment?
Yes or no? If no, we need to pass to others winner.
Pass it to another winner.
Okay, we just count into 10.
We'll give a countdown, yeah? 10, 9, 8, 7, 6. Luis, are you here? 5, 4, 3, 2, 1. All right. So for Luis, unfortunately, you won't be getting the free treatment from us because you were not in the live, and we removed you, and we will spin again.
Oh dear.
Okay, congratulations to Raihan Muhammad Yusuf. Are you in live right now?
Congratulations.
Ivy is eager to win. Ivy.
Ivy, yeah. Ivy always said that.
Let's go.
I want your treatments. I want your free treatments. I will join this Friday. She always mentions. Yes or no?
Okay, can we all call out for Raihan? Is Raihan in? If it's a yes, you can put a comment in the chat box.
Or just say hi, I'm here. Just let us know.
Okay, I'll just give it a countdown from 5, 4, 3, 2, 1. Right, I'm so sorry, Raihan, that you'll be removed from the second lucky draw. I will draw for the last time. If this time there's still no more winner, then I'm so sorry. Okay, let's see who will be here.
Oh, Ivy! Yes! Ivy 你赢了 Nicholas 的
Congratulations, Miss Ivy!
Ivy, we're having a free treatments for you from Nicholas.
终
Yes,
于
so
中到
Miss
你
Ivy
了。
is having a free treatment from Nicholas. Okay.
有没有
So
在
now,
Ivy 有没有在？
有没有
Yo, Ivy 进来了
comment
，comment 了。
哇 ，OK， 这个快啊，手脚快啊。OK， 看谁这个就轮到我咯。
Okay, so
看
for the last spin, treatment will be done by Professor Dr. Sky Sin. Okay, let's
Alright.
spin the wheel.
看谁最 lucky 哈。
Okay, congratulations to B Chin. Is B Chin in the live right now?
Bichin 有没有在这里啊？
I think she
有没有
commented before. Is she here
Yes or
now?
no? Yes or no?
Are you here, B Chin? If you are here, you can put a comment in the chat box. Yes, she is
Oh,
here.
yes.
I saw her reply.
Oh, congrats.
Congratulations, B Chin.
好，你会跟我的 front desk make appointment， then 我会亲自去见你。
Okay. So thank you so much everyone for joining our session today. 感谢大家呢可以参与我们今天晚上的 live. To all the winners, you may PM us and I will lead you to our clinic for the consultation. And can Nicholas put up the slide for next week?
Yeah, sure thing. Give me a second.
So I will preview what's going on for next week.
Yes.
If you guys
Yes,
have
what do you
any topics that you would like to listen from our doctors or from our physicians, you may put in your comments in the chat box so we could know what are the interests and what are the trending interests right now in the public.
Okay, next week the slide 在哪里啊？去。对，我今天都没有时间跟他们打招呼哦。今天谁有在里面？来，我去 check 一下先啊。看一下。谁还在的可以跟我打招呼一下。我看到 Terence，Hi Terence， 还看到 Sean、Shana、天伟、Jackson， 你好。Crystal， 我看到 Crystal 的名字啊。
OK， 那我先预告一下，下一个星期我们会讲的这个课题就是 Lower Back Physio Exercises. Did you move your back right? 你动对了吗？那下个星期呢，我们的这个 physiotherapist 呢，他会教大家关于这个我们日常做的这个 physio 呢，你到底有没有做对，还是有做错？那记得留守我们下一个星期的这个 Talk-in 也是下周五晚上9点，我们不见不散。
下个星期你不要穿运动装哦，他们会叫你动起来，怎么样动才是对的 for your lower back exercise。好吧 ，So 今天我们就到这里，谢谢大家的观看，我们下个星期见，拜拜，大家晚安，
拜拜。
晚安。
Good night。